Hello, and welcome to Module 14, the role of oxygen in wound healing. Our objectives for this module are to review the causes of wound chronicity, discuss the role of oxygen in wound management, detail the contraindications for NATROX topical oxygen therapy, and illustrate the use of NATROX topical oxygen therapy in chronic wound management. What is topical oxygen therapy? Topical oxygen therapy is the direct topical application of oxygen that diffuses into the tissues to support wound healing. It can be continuous or intermittent, and it is considered an adjunctive therapy to moist wound healing. Let's talk about wound hypoxia. Wound hypoxia reduces the chances that wounds will go on into a healing trajectory because hypoxia reduces antimicrobial activities. It also decreases cellular metabolism, such as the expression of growth factors, collagen synthesis, the formation of an extracellular matrix, and also results in reduction of cell proliferation and migration. Lastly, wound hypoxia also contributes to reduced angiogenesis. Clinical signs of wound hypoxia include the presence of devitalized tissue and necrotic tissue, unhealthy, friable granulation tissue, frequent wound infections, and then ultimately failure for the wounds to heal. In normal skin, oxygen levels 3 to 4 millimeters below the skin level are 45 to 65 millimeters of mercury. Tissue oxygenation in chronic hypoxic wounds is found to be between 5 and 20 millimeters of mercury and can be as low as 0 to 5 millimeters of mercury in revascularized regions. It is important to note that wounds with less than 20 millimeters of mercury of oxygen convert to anaerobic metabolism, which is detrimental to wound healing. Pivotal studies have shown that wounds in a healing trajectory typically will close in total wound area reduction anywhere from 40 to 50% in 4 weeks. Venous leg ulcers, we like to see 20 to 40% reduction in wound area within the first 2 to 4 weeks of therapy. And in diabetic foot ulcers, we typically look for a reduction of 50% by week 4. Wounds that do not show these levels of healing within this time frame are considered non-healing wounds. This should trigger the need for patient and wound reassessments and reevaluation of our treatment plan. The role of oxygen in wound healing. All cellular activities are oxygen dependent. The need for oxygen is actually 3 times greater in wounded tissues. In the wound healing cascade, oxygen is essential for angiogenesis and neovascularization, which is new blood vessel formation. It supports cellular activities, cellular metabolism, and energy production. It also supports the body's immune system so that it can conduct antibacterial activities. Oxygen is needed to promote growth factors for signal transduction to call those cells into the wounded tissue to start repair and regeneration. Oxygen is needed through the collagen synthesis so that we have a good triple helix of collagen formed to provide reduction in the wound size and contracture of the wound. And then oxygen is needed for cellular proliferation and eventually reepithelialization and wound healing. The role of oxygen is essential during the neutrophil or macrophage respiratory burst. Producing that reactive oxygen species during the respiratory burst is important because this is how the immune system will clear microbes and any debris within the wound tissue. As mentioned, adequate oxygen levels are essential for the signaling process of growth factors. This is apparent in the need for growth factor signaling to produce angiogenesis or new blood vessel formation and support repair and regeneration of the extracellular matrix. Let's talk about NATROX topical oxygen therapy. So what is NATROX topical oxygen therapy? It's an FDA-cleared, CE-marked, compact, battery-operated wearable device. The device generates continuous oxygen, so 24 hours a day, 7 days a week, to the wound. The oxygen generator produces oxygen from the environment through an electrochemical reaction. The oxygen is then generated and delivered through the oxygen delivery system, which is this wagon wheel device, as you can see on the screen. It is 55.7 millimeters in diameter, and this delivers oxygen to the tissues directly to the wound at a rate of 11 milliliters per hour. The design, the wagon wheel structure of the delivery system also allows for exudate to pass from the wound into the dressing. The cording is flexible, as is the delivery system, and is compatible with most dressings. You should always use a semi-permeable dressing over the oxygen delivery system. The tubing is 3 feet in length, so it can be put onto the patient's belt loop, and the oxygen generator can also go into a pocket, or it can be strapped onto the lower extremity via the holster. It's used as an adjunct to current standard of care, so it fits into your clinical algorithms that we've discussed. By providing supplemental oxygen, we can stimulate the wound healing cascade. The design is meant to promote compliance among our patients because the device is discreet, it's lightweight, it's portable, and it's very easy for the patient to use. Let's talk about application of NATROX topical oxygen therapy. NATROX topical oxygen therapy is intended for wounds healing by secondary intention that would benefit from supplemental topical oxygen, which includes diabetic foot ulcers, leg ulcers of venous or arterial or even mixed nature, pressure injuries, and also surgical or traumatic wounds. Again, it's an adjunctive therapy, so it can be used under compression or with offloading and in combination with most of your typical dressings that you're already utilizing for wound management. There are some contraindications to be aware of with topical oxygen therapy in general. We don't want to use the device in patients with any known hypersensitivities to any of the system components. You would not use topical oxygen therapy for the following wound types, which would be thrombophlebitis ulcers, Raynaud's disease, any ulcers with active infection, bacterial, syphilis, deep fungal infections, or tuberculosis, You do not want to use topical oxygen therapy in wounds that have active, untreated osteomyelitis. It is contraindicated to use topical oxygen therapy for any cancerous lesions. And also, it would not be recommended to use topical oxygen for any bites or third-degree burns. Additionally, topical oxygen therapy should not be used in wounds that are completely covered with slough or necrotic eschar. Wounds with fistulas or deep sinus tracts where you can't probe the end of the sinus tract would not be appropriate for topical oxygen therapy. If the wound is covered with any petroleum-based dressings or ointments, you would not use topical oxygen therapy. And any patient that does not have adequate perfusion to support wound healing should be evaluated by vascular, and any blood flow should be optimized before utilization of topical oxygen therapy. So what should you expect when you utilize topical oxygen therapy in your clinic? On average, you will need to use topical oxygen therapy and maintain NATROX for 8 to 12 weeks to achieve complete wound healing. In week 1 and 2, after utilizing NATROX topical oxygen therapy, you will likely see an increase in the amount of exudate. There may be a slight increase in wound size, but you should see a decrease in overall wound pain. In the following 3 to 4 weeks, you will then see exudate levels decrease. Wound size will reduce to at least the original size or can continue to reduce even more. And you will see improved wound bed color and more robust granulation tissue formation. By week 5 and beyond, you should consider reevaluation of the wound size, and you should see a significant decrease in the wound size at this point. Increase in granulation tissue should also be present, and you should see new evidence of re-epithelialization of the wound clinically. Here are some additional references. And this completes Module 14. To complete the test, please click on the red test icon on the bottom of your screen with the clipboard and pencil on it to receive your certificate of completion for this module. Thank you.